Hello everyone. Today we are going to calibrate for a ESWL. So the first thing we do is grab the Phantom, which you'll see how important it is for this process. This is the ESWL cable. So first thing we need to do is turn on the power, which is right down here. It goes clockwise. And also the C-arm that's used for these gets turned on. Next thing I do, the table's not set for an ESWL right now, so I'm going to do that. This draw sheet gets folded like that. This flannel gets peeled back. The goal is to have this area free of, eventually free of any cloths, blankets, whatever. That's for the paper. Next thing I do is take out the center pad that's in there for other procedures. But for ESWL it comes out just like that. Unit is ready to go. This is navigation pad, pretty much. These are the buttons we use to control the table. So this one will rotate it. And what we'll raise you is just hold it down. Just go pretty high calibration. And every movement that this table does, when the does, it's complete and there's sound. That one. So the different modes for controlling different functions, different table. So the P head down here, and this arrow is down here indicating this button will be the therapy head. So again, you'll hold it down, then just hold, and it will make a sound when it's part of the therapy position. Down. Next thing is the therapy head right now, just doing what it's look at do. It's go ahead, it's water. It's for calibration. Suppose you want to shut it off. So, but in here, put it off. Go to menu, and this buttons to scroll down to use cushion. These and then scroll button will access the cushion and this on and off, and X button will on and off. This turn. And the reason for that is we're about to attach this. Always move this. So this is the Phantom that is very critical in calibration, and it attaches to the therapy head. So 2 knobs and a bolt. You line up the knobs with the grooves on the side of the therapy head, and the bolt with the little hole. And screw it in. And just give it a little wiggle to make sure it's tight. Alright, the next thing we do is C-arm gets positioned. So what you want to do here is just get perpendicular to the table, and you may notice, or you will notice in a second, there is a piece of red tape on the floor. So I use that as a guide just to where the back wheel, or the wheel of the C-arm will end up. So what I do is I turn the handle sideways, inward, and move towards the table. That is the position you want the wheel in, just in front of that red tape. And what I'm looking at now is whether the C-arm base and the Storks table base are parallel. So I'm just going to move closer till they touch and make a little adjustment. And that's pretty good. Okay. I'm going to move this a little closer. And I'll just, for interest's sake, I'll just bring up a case, or not a case, calibration images, so you can see what we're trying to achieve here. Okay, so this is AP calibration. That's what you're going to see eventually. So now we want to unlock this lock, and these locks have, every lock we use has a letter on it, so A, B, C. And we're just going to move this. We're trying to get the X-ray tube centered directly beneath the focusing cup there. So just eyeball where that is. The next thing, just to, eventually we're going to have to orient the C-arm so the patient's correct anatomically. So, and for calibration, it's good just to do that. So, both these R's get pressed. For calibration, I also press pulse and low dose, just so there's very little radiation. And I use this. Okay, next thing is to fluoro, see what we need to do to get this image. And as you can see, it's not quite the same as that one. So a few little adjustments and we'll make that right. So what first thing I want to do is, using this in and out lock, move it so those vertical lines are superimposed through that dot and lock it. The next thing, the base of the C-arm will move the field of view into, it's pretty close now, but what we want to do is get this field of view within this circle. So you can see there's a bit of a gap that we're going to fix right now. To do that, you move the base while you're fluoroing, of course, and just keep adjusting it until you, don't worry about the horizontal line. Once you're happy with that, these are critical to know exactly where the center of the monitor is. So now, I'm happy with the field of view. It's right within that circle. The only problem is the horizontal lines aren't superimposed through that dot. So that's where this lock comes in. E-lock, unlock it, grab the handle, fluoro. No, it already went. You're going to find when you lock and unlock the C-arm, it's sensitive enough that it'll move a little bit. So that's what makes it a little finicky. That's actually, so that's actually pretty good. It's a little, if you want picky, you close that, let's just tap there. It's actually where I want, so I can move it. Lock off and it, move it, lock again. So now, lock, adjust it. I'm just gonna, okay, so AP calibration. That's, you can fiddle around a little here to close that gap. It's long. As far as the purpose of this is to make sure perp energy shock things are hitting that earth spot. I think we've been. The next thing to do, actually before I do that, I'll just point out these locks are designed for this procedure. And after that fiddling around getting the AP, I'm about to move the C-arm off of this position. So what we want to do is make sure this lock is in place. So then when we finish doing what we're about to do, we you can come back to that here. So that stays there unless I want to make some kind of adjustment. But that's, I hardly ever take that one off. I took this one off just to show you how it works. So this is how it should look in the axial calibration position. And if you look over here, we just have to make a little adjustment. So I'll show you how to do that. So what you do is just take that lock off, and while you're fluoroing, move the C slowly. So the lines go toward the tip of that object, and basically as if it's a line going right through the center of a circle. And then you lock it. Always fluoro again after you apply a lock. Sometimes it changes. And that's your axial calibration position. So before you leave this position, you put this on, and it just slides on like this. You make sure it hits there. Tighten these so they don't come off easily. And then you can go back to your AP position, right up to that lock. Always give it another shot to make sure nothing's changed. And I see a little tiny adjustment needed there and here. Basically, lock A and lock B just fix the vertical and horizontal. So now we have AP calibration and axial. So now what you can do is take the phantom off. And it's a little bit heavy, so just be careful once you unscrew it, but you have a good grip on it. Slide it back. So we're going to assume that we have a patient on the way. So this panel is showing us that everything is ready to go. It's highlighted in white except the energy. So what the machine wants is a high voltage test. All you do for that is just lift this slightly, press this green button, the trigger button, let go, and then in about 10 seconds this will turn white. It's just a simple test that will allow you to have energy when the time comes. I want to do is initiate the filling of the therapy head cushion before I put it to park position. So to do that, you just press this button, top button, that'll turn the cushion on. Then you press therapy head mode. Then you press this, and it's telling me the cushion's filled, so let go and then press again. And if you look at the cushion, you'll see it draining. And all that did was, when we're ready to bring the therapy head in for the patient shockwave, that will automatically fill up. If you forget that step, it's no big deal. You just go into menu, down to cushion, 4 o'clock, and then 12 o'clock to turn it on. Okay, so next, I'm going to prepare for the patient. Table Euro will bring our cable all the way to the bottom. So it's just a matter of holding on to it. And of course, once you've got this calibrated, you don't want the C-arm to move. The only thing you move on the C-arm from here on in is the C-lock to get into your axial end. So we calibrated our C-arm to the therapy head, and now we have a patient on the table. So what happens is the patient will come in on a stretcher, and they would have had an x-ray prior to this. And that's important because if you can't see the stone on just a plain KUB, then it's going to be very hard to target for an ESWL. So there'll be the KUB up there. So the nurses will assist the patient to the table. They'll make sure their gown is untied at the neck. Now make sure the lead apron is on. Without question, actually, there's two ways that the next step can happen. And what you have to do is consult with the anesthesiologist and just ask them if they're comfortable moving the patient before they intubate. And most of them are, they don't mind that. Some of them are a little sticky about having their head right in this spot for intubation. So it doesn't matter to me, I just say, okay, well, you do your thing, and then when you're done, then we'll move the patient. So in that case, this draw sheet, I leave it in, obviously, because once the patient's asleep, you need something to help you move the position. So we're going to assume that anesthesia has said, it's okay, you can move the patient first, and we'll carry on from there. So we'll say this patient has a right stone. So what I want to do is get them to move down the bed. And I always tell them you'll feel your bottom hit a little ridge. And that's usually about right, because this is the general area where the renal kidneys are. So it's a right stone. So what I want this patient to do is to move towards me, towards the left. So the right side of them is more centered under the maybe a little more. Okay, and the reason this is important is if you can get the stone as close to the center as possible initially, then it's a lot easier once the therapy heads in to get it lined up in the crosshairs. So that's the main purpose of this. And the reason I had her move was what I would do now is fluoro to see how I did as far as, or if the stone is in the ballpark. What you want this stone to be somewhere in this. When you're fluoroing without the therapy head, you're going to see more field, obviously. So what you have to think about is the stone going to be in this area once the therapy heads in? It doesn't matter if it's dead center, as long as it's somewhere in this field. Right? And another reason I forgot to tell you about why you want the patient to move first is the table has limited movements in all directions. So once it's zeroed, when the patient's asleep, then you have parameters where you can fine-tune the stone positioning. Phantom that works very well for approximate the size of the stone, and it's pan nib. So the patient, if it was a right stone, you just imagine where it's sitting in their abdomen. They move down the bed and move towards the left. So we'll just put it right here. Okay, so we'll assume there's a patient still on the table. And before they're asleep, what I would do, I'd raise it up a little bit. So table litho, we'll raise it up. And this is just to cut down mag a bit. And then I would fluoro. So you're going to have the cones open a little bit so you can see, the stone's hard to see. You want to be able to locate it. Okay. So there's the stone, and it's kind of, right now I can tell that it's too far lateral for when the therapy head goes in. That's what we're going to see. So we want to make sure that the patient moves enough that that stone is more centered. So I would just ask them to move a little bit more to the left and a little bit more down. Very cooperative patient. Oh my goodness. Okay, so if you see that, you can be happy because you know when the time comes, when the therapy heads in, you're going to be able to locate the stone and fine-tune the centering and the crosshairs. So what I do at this point is I get the patient to take a breath in, blow it all out, and then take a digital spot, and I'll pretend I did that, and swap it. So now the image on the right is our reference. So once the shocking gets underway and continues, we can always compare what's going on with that. Okay, so now I say to the anesthesiologist that everything's good, you can continue. And at this point, there would have been this draw sheet underneath the patient just for their comfort. I would get them to just raise their back a little bit so this can come out. And then, to be nice to the patient, and also to help with coupling of the therapy head, this goes on here and this goes onto their legs. Alright, so anesthesia does their thing. Patient's asleep now. While that was going on, very important step has to take place. This silicone oil has to be applied to the therapy head. So you put a glove on, you reach over here, and you just squirt about this much, a toonie size or so, maybe a little more. Spread it around in your gloved hand. There's a thick coating of silicone oil, therapy head, and that's for cups to the table. And you'll see the next. I'm going to raise it. So in this end, happy. I'm going to now more table anesthesia's, and I'm going to raise it a bit and shot to make sure the patient hasn't moved. This and patient happy with the position. Then I'll raise the final. Actually, let's do it first. There's no water in the room, but I'll warmed water full of sterile water. Gets put into the room. And it's good for tooth problems if you're doing a row. Usually, so you would be bright stones. I would. So ensure the patient's gown is out of the way in the back. And there's nothing going to be underneath the patient that will absorb the water. And then I pour the water under about a third to a half of the liter. And then I lift the patient gently just to make sure the water goes underneath, and then I'll rub underneath just to make sure there's no air pockets. An air pocket will stop the shock. So once that's done, then I raise the table, and if you watch as it goes up, it already happened, but there's a little pause, and that just means that it's gone high enough that the therapy head will now pass under without hitting anything. Not that it would ever hit anything, but so therapy head, and we're going to put it back under. And wait for the sound. So we know it's in therapy position. Because we initiated the cushion filling earlier, it's filling up now. And what it's doing is it's got a sensor that will sense the bottom of the table. It's just trying to adhere to the bottom of the table, and the oil causes a coupling effect. The water under the patient will enable the shock wave to pass through all that into the patient, into the stone that we're about to center. A little radiation protection. So now what we do is fluoro. I wish this happened every time. Now, if you cone in to the circle, you'll get a better image. So it just so happens that the stone is exactly where you want it. And that doesn't happen very often. But let's say it wasn't. Let's just say it was it's still in the circle, but it's not in the crosshair. So fluoro, this is what you usually find. So what you're going to do is move the table controls.
Are you in litho or euro?
Table litho.
Okay.
If you're in table euro, all the controls are the same except these ones, the side to side. That becomes Trendelenburg now. But so you don't want to be in that. You want to be in table litho, so you see all these arrows. So I moved it laterally, so it's going more towards the center. It's still too high, so now I'm going to move the table down. Obviously the patient can't help now because they're asleep. And then you just fine tune it into the center of the crosshairs. And the thing that's you have to watch for is the patient's still breathing, so you have to just watch fluoro long enough to see where the stone's going to rest when the patient exhales. It'll sit there for a good amount of time to get as many shocks as possible. So you just watch that, and then you save that image, and you don't have to swap it, but the one on the right and that one, and a couple more that I'll tell you are going to want you to send a few later. So once you have that, check. It's very important, and that you positioning earlier. So you just tell that position for the lock. Go into fluoro. Right. Okay, so now what we see, and this is what you normally see, the stone is going to be to the left of this vertical skin. So what you want to do is raise the table so the stone will be protected by that. So we just go back to this pedal and raise the table. And you'll see the stone start to rise. Once it's there, we're ready. So you would save that one, go back to AT, gently lock that, always check again, make sure you don't need any more adjustment. And then basically the tech, make sure that shockwave mode is enabled, and now the urologist will come in and they'll initiate the shock. So you just lift the trigger, turn it around, pull it down. Now it gets really boring.
So at the very end now, what are you sending to PACS?
Okay, so let's say we've done the amount of shocks that the urologist has determined and others that the stone has been shattered enough. So 2,500 is the maximum shock that they'll apply. But if they feel the stone's gone earlier than that, then they'll stop. They'll just pick a number and stop. So once the shocks stop, then the tech will take the therapy head out. So therapy head mode. It's always going to say coupling cushion is filled, so just let go briefly and push again. The therapy head's draining. Got one part
Okay, go.
that
This is
you
the
may get
addendum.
asked to do. So we're shocking, and during the shock treatment, doesn't sound too good. The shock treatment, we fluoro periodically just to make sure
With the therapy head in.
with the therapy head in. So while the shocks are going on, and if you fluoro and you see that the stone is no longer in crosshairs, there's two ways to fix it. You can stop the shocks. You would have been on this, and then you go to table litho. All your parameters are available. You fluoro and move the stone accordingly. If the stone is still getting some shocks, that it's not exactly in the crosshairs, you can keep the shocks going, and table litho gets pressed, and you can see that the table movements aren't available. So it says shocks are emitted. That's okay. All you have to do is press this black button and hold it. The green lights come on for the arrows, and that's why we have the foot pedal available, because you need two hands for this. So we're holding the black button, I'm going to fluoro, and I'm going to move the stone. You'll find you'll be doing a lot of that during the procedure, so it's good to know. Once they're happy, you let go, and you always put it back to shockwave, because the urologist may want to raise the energy, lower it, whatever. Okay, so when the shock waves are being applied, a certain amount will have already been applied, and the urologist may want to increase the focal size, so that's easy to do. If it's in shockwave mode, these buttons now coordinate with different aspects of the shockwave mode. So for the focal size, it's these two buttons. So to increase to large, you press this one. When that's pressed, you lift. Anyway, what happens is this circle dot becomes a circle. It takes about 15 seconds. That'll fill in. Now we have large focus. You just have to initiate the shocks again. And that's that. Let's make this really. And I'll take another digital spot. Look at that. The stone is gone.
Okay.
So then, if we had another Eswl booked, what you want to do is go to menu and scroll to positions. And this is telling you that there's more to the menu, so you press that and you press that once more. And position 1 and 2 have been programmed to 0 the table. So all you do is hold this down, and whatever movement you've done will return to center. If it starts to go up, you know you're centered. So then you just press table Euro, and now you just go all the way down. If we were done the case, then if we're done ESWLs, then at this point I would move the C-arm out of the way to make it easier to get the patient onto the stretcher. If we have another one, then obviously you don't want to touch the C-arm, so you just have to be careful when you're helping to move the patient out. What I do is I ask the anesthesiologist for the suction hose to get the water out from the patient, and then I assist moving them onto the stretcher. You're going to send, I don't know if I say it. So you're going to send your,
I'm just going to shoot over your head here.
when the patient was still awake, you took this one, which shows the stone. You swap that. So that will go to PACS. And then you will send the AP positioning with the stone in the middle, the axial.
With the stone in the middle.
Yep. And then the final. And then you come over here and record this information. And yeah, there's a little stamp that has it all written out. And that just gets entered into RadNet exam management. And that, my friends, is an ESWL.